You need to hear this if you're a healthcare professional dealing with upset patients. Acknowledge and validate their anger. Start by saying, "I can see that you're very upset right now." Follow up with, "It's understandable to feel this way given the circumstances." Next, provide information and options. Explain the consequences clearly. "I appreciate your concerns, but it's important to understand the potential outcomes if we don't proceed with this treatment." Then, offer choices. Let's look at a few options we have. Which one do you feel comfortable with? Maintain professionalism throughout. Keep the conversation bilateral. Let's collaborate to find a solution that works for you. Use clear and concise language. I will walk you through the process step by step. Is that okay with you? Finally, follow up and support. Reassure them. Take a moment to think about it. We want to ensure you're at ease with the decision. Be patient. I know this is a lot to take in. Please take your time, and I'm here for any questions or further explanation you might need. Employ these strategies to effectively manage the situation and ensure the individual feels heard and supported.